Good morning, everyone. My name is Dina, and I'm one of the team here at Elderwerks Educational Services. Elderwerks is a non-for-profit 501c3 organization whose focus is to serve our seniors with advocacy, education, and resources. We provide complimentary aging counseling for older adults and their families so that they can age well. One of the things we do is provide sessions of learning like today. We are thrilled to have Michael Mann here to present Medicare 101, What You Need to Know. I'm going to ask that you put any questions you have in the chat and we will answer them after his presentation. Please do keep yourself muted and your cameras off during the presentation. Thank you so much. Mr. Michael, take it away.
Thanks. Good morning, everybody. Thank you for joining in. Medicare is very important, and I know it's one of the most confusing things out there. And unfortunately, with seniors, they make it even more confusing, which is not right. So that's why I am where I am, to help people out. Here's a little bit about me, Michael Mann. I'm appointed with Health Markets. It means that I can really go to any carrier. Aetna, Cigna, United, Devoted, United Healthcare, ARP. I'm also licensed in 17 states, which means if you have loved ones in other states, I can also help them as well. I'm local organizations. I'm involved with Crows and Clients Foundation, the Barrington Chamber of Commerce. I am a trustee for the Village of Deer Park, the Barrington Career Center. I am Spirit, and I also do lots with Elderwerks as well. You're going to notice in the very bottom of every slide, you'll see my name and phone number, along with my email address. Please feel free to put any questions you might have in the chat box, but keep in mind, Medicare is very, very highly regulated. So I can only say a certain number of things. This is an educational session. It's not a sales or marketing. So if you have a question about your particular, if you have Aetna or whatever else, I can't really answer those particular questions. I can do it afterwards. That's why you got my phone number, or you got the Health Markets, or in the chat box, if you want to put Michael, please call me up, and here's my phone number. I can do that. But otherwise, I'm not allowed to talk about any specific plans and that type of stuff. Are we good? Okay. So keep in mind, my name's always down there, so if you ever need me, just give me a call. So key terms, just to get started off, we got beneficiary, premiums, deductible, co-payments, co-pay, and co-insurance. So the way that works is beneficiary. Who are we talking about? That's the individual itself. It's not the person getting the money, like we're doing life insurance, the beneficiary of the plan. Beneficiary is you yourself. Premiums, fixed amount you pay for coverage, usually monthly. You will do that with your Part B. We're going to talk about that later. And deductibles, that's the money they take out first, the fixed amount you pay before insurance starts paying. Co-payments or co-pay is a fixed amount. That's like when you go see your doctor. The primary doctor, Medicare plans are a lot of times zero. The specialists are $30, $40. But then co-insurance is a percentage of the service that you pay. So it might be 30% or 20%. So as we keep on going on, more and more about that. So let's meet Joan. She's 64 years old and planning to join Medicare at age 65. She doesn't know much about Medicare. Federal health insurance programs began in 1965 was when the Medicare Act began. And it provides health insurance for people who are 65 and older, who are 65 and under with certain disabilities like end-stage renal disease, ALS, and also you get that famous red, white, and blue card you see on TV a lot. And that's what shows your hospital Part A, your medical Part B. After some research, Joan learns Medicare is not a single government insurance program. It's actually 4 parts. And we just talked about that a minute ago. You got your hospital Part A that covers your skilled nursing, all the hospital, home health care, and hospice. B, doctors, preventative diagnostics, and DME, which is durable medical equipment. C, Medicare Advantage plans. We've heard about those all the time on TV, and you're getting tons of phone calls. You're getting letters sent to you. And then D is prescription drug plans. So we got A, B, C, D. You're not seeing on here Medicare supplement plans because that's really thrown in with the A above and the B. Parts A and B are known as original Medicare. So some people out there just have original Medicare. They don't want to have Medicare Advantage plan or Medicare supplement. They'd rather just go with the A and B. Part A. So who qualifies? You have to have 40 quarters of work for 10 years. Or you qualify because your spouse benefits. Or you can not qualify. You can up to pay $4.99 a month, and that's going up every single year. This is 2024. For out-of-pocket for hospitalization, it's $1,556. Once again, this is all 24, 25, everything's going to go up. Covers period 1 through 60 days. Then 61 through 90, it's $389. And then days 91 plus, it's $778 for a lifetime. And then skilled nursing up to 100 days covered. So you go to the hospital, break a hip, you have to go to a nursing home, you get 100 days coverage. 100 days 1 through 20, you pay $0. And then days 21 through 100, it's $194. If I'm going too fast, just let me know, Dina. Now that she knows hospitalization is covered by Part A, what about Part B? Premiums based on income, $170. So everybody who's not on Medicaid or has a higher income, like $115,000 or higher, is going to be paying $170 per month for their Part B. That's this year. Next year, I don't know what it is. My hunch is about $190 is what the Part B is going to be, but we don't know yet. We'll find that out in October. Covers medically necessary services, covers preventative services. That would be like getting your flu shots and stuff like that, and your doctor visits. So she has to pay premium Part B to cover her other services, which we talked about, the $170. What about the out-of-pocket costs might she face? The deductible is $240. So we're just talking original Medicare now. We're not talking about Medicare Advantage plans or supplement. If you just have original Medicare, you're going to have to pay $240 before the whole plan starts kicking in. So the first deductible you pay is $240. And then it's 80-20. Covers 80% of the cost, beneficiary pays 20. $1,000 bill, $800 the government will pay, $200 is what you would pay. And then there's the excess 15% excess charge if provider doesn't accept Medicare assigned rates. And not everybody, if you have a concierge doctor, stuff like that, they're not, a lot of them don't take Medicare. So if they don't take assigned rates. What parts A and B don't cover? Joan learns that Medicare won't cover every expense. And she doesn't look too happy, does she? First, it doesn't cover acupuncture. It doesn't cover chiropractic services for the most part, except for the sublation. The nursing home, long-term care, dental, indentures, and some people even have implants. Hearing aids, routine vision and glasses, except for cataracts. So if you have cataract surgery, that's still covered under B. That's more of a medical thing that's done with your eyes, but just getting your eyes examined and getting the contacts or glasses is not covered under the original Medicare. Emergency medical care outside the United States. And then the prescription drugs. So you probably have heard about that. Because prescription drugs is under Part D, D drugs. So how does she get Part D and what kind of expenses could she face? She finds her prescription drug plans are offered by private insurance companies, the Aetnas, United Healthcare, Humanas, Devoted. She needs to enroll into Part A and or B to qualify. She could face a penalty for late enrollment. So one thing I can say to everybody who's going to turn 65, or if you're a power of attorney helping family members that haven't already signed up for Medicare, always sign up for Part D. If you have a supplement plan or if you're doing original Medicare. Why? Because the penalty. And I've helped people after 30, 40 years finally needed to get a prescription drug plan because the discount was so needed because they wouldn't want to pay thousands of dollars for prescriptions. that they're paying $40 to $50 a month just on penalties. So it adds up quickly. I can only tell you, please, please, please make sure if you do a supplement plan, not a Medicare Advantage plan, but a supplement plan or original Medicare, sign up for a plan. Even if you're totally healthy, not taking anything at all, if you can afford it, just sign up. Right now there's a $0 plan with the company, but there's also other plans that are very minimal in cost, and you should at least sign up for that just in case. She also learns you may purchase a standalone plan or may include a Medicare Advantage plan. A deductible usually applies, so all prescription drug plans, most of them, a deductible does apply. There are formularies, and premiums can range from $15 to $100. And what formularies are in tiers, you probably heard about drug tier 1s, 2s, 3s, 4s. That's just expensive. Like tier 1s are the basic, the statin drugs and stuff like that. They might be $0. But then when you get to the more expensive, anything you see on a TV commercial is pretty much a 3 or 4. So that's how you get your drug formularies. Turns out all Part D plans have the same structure. This is 2024. Please, please, please pay attention to this little part here, if anything else, because this is the biggest change for 2025. So there's a deductible, there's an initial coverage period, there's a coverage gap known as the donut hole. Those people that are paying a lot of money for their prescriptions every year definitely know what a donut hole is. And then the catastrophic cut stage. So let's talk about this. We know about deductible, it could be $300, $500, whatever that first amount you pay before you get the discounts in your prescriptions. But then about the initial coverage, you got the initial coverage gap, and then catastrophic. So we got the deductible we talked about. The initial this year for 2024, you're spending up to $5,030. That's the Part D copay. And then you got the balance. Plan pays the rest, whatever that is. And then we got the gap. The threshold's $8,000. So between $5,000 and $8,000, that's the donut hole. Every time you're hearing about the donut hole, because that's what pays, it costs more. It does make sense, but it costs more to pay for your prescriptions between $5,000 and $8,000. But then once you hit the $8,000, it actually this year has gone down to $0. So you're paying $0, but $8,000 is what you're paying at the current 2024. But hold on, this is what's going on for 2025. The donut hole is going away. Going away. There's only $2,000 out of pocket. So what does that mean? That means if you don't have an agent, please find one for this year. It's very important to look at your plans. If you don't have one, you're more than welcome to just put your name down or give me a call or email later. But I don't care. You at least talk to somebody, because all plans are going to change this year in some way or form or another. Because now we're down to $2,000. We had $8,000. Now we're going to $2,000. So that's $6,000 difference. The insurance company's got to take it from somewhere. So the premiums that you've seen before, they're all going to probably go up. What percentages? I have no idea. We're going to find out on October 1st is when I find out, and then everybody else will find out as well. But there are going to be massive changes, I believe. And it might be, you might see less dental, vision, and hearing for Medicare Advantage plans. You might, instead of being 5,000, might be 3,000. They're going to be adjusting lots of things. And that's why it's so important that you talk with your local agent you talk to, or if you need help, you know where I am. But talk to somebody. Just don't try to figure it out yourself. It's a free service, so why not talk to somebody? So most important, this is for anybody who's on a Part D plan with supplements. But even if you have a Medicare Advantage plan, there's going to be lots of changes. So both people, really everybody with Medicare, should be talking to somebody. Lots to consider. An extended hospital stay or serious illness could affect her retirement plans, even Medicare coverage. The premiums, the deductibles, the co-insurance, the co-pays, the donut holes, although we don't need to worry about this year, next year, but we do this year, and not covered expenses. So we've all heard about the supplement plans. Joan calls her friend Diane, who enrolled in Medicare last year. Diane purchased the Medicare supplement plan, tells Joan, sometimes called Medigap, also sold by private insurance companies. You see lots of AARP TV commercials, but Aetna, Humana, they all sell it, WellCare. Works with original Medicare Parts A and B, helps cover gaps in Parts A and B, like deductibles and coinsurance, does not include Part D, which is drugs, prescriptions, but standalone separately, and cannot have if you have a Part C. So you never can have a Medicare supplement plan and Medicare Advantage plan. You can only have one or the other. You can't have a supplement plan, and we want to get that prescription drug plan though. So you want to get both of those. And what does it really mean, the gap? It covers the extra 20%. So in most plans, the government paid 80%, you're paying 20%, if you remember from the original Medicare. Now, with a supplement plan, it's covering everything else. So that means this confusing chart. Most of the time when I work with people, I'm either doing a G or an N. I might have people on this Zoom right now that have F. F's no longer available. It is if you're a certain age, but otherwise you cannot get an F. So G, why I like G is everything's covered except for your Part B deductible, which we talked about was $260, but who knows next year. And you don't have to worry about taking your wallet out of your purse or pocket. That's what's good about a Medicare supplement plan. The G, for example, here, all Gs are the same. No matter what the company is, they're always the same. Some companies are higher or lower, but they're all the same. And the big difference here is you leave your wallet in your pocket, you go see your primary doctor, covered. You don't pay for them. You see your specialist, you don't have to pay for her. You go to the hospital, you don't pay for that. So you don't take your money out. For anything that would be covered under A and B, now you're not paying anything because it's covering that 20%. But you are paying a premium every single month. So Medicare Advantage plans, you don't pay anything. Supplement plans, you're paying a premium every month. And you see like the plan N, you see a little asterisk next to Part B coinsurance. You sometimes do have to pay the doctors $20 copay or $50 for specialists. That's why when I usually steer people toward G more, because they don't have to take their wallet out ever. But it's up to you, of course. So then talking to Diane helps ease some Joan's concerns about cost of care. So we know right now that supplements cover everything. You just pay a premium. It covers that extra 20%. But she talks about Phil, who has a Medicare Advantage plan. So you see Joe Namath, Jimmy Walker, those people doing TV commercials, that old lady with glasses. They're all talking about Medicare Advantage plans. You're unfortunately getting tons and tons of letters in the mail, which I feel so bad about. And more importantly, you're getting phone calls. Totally illegal. They're not allowed to be calling you up. That's why I've asked you to call me, because I'm not allowed to call you. I follow the books. But that's because of Medicare Advantage plan. They want to help you with that. Great, more letters. Phil explains Medicare Advantage are offered by private insurance companies, the same ones I mentioned before that do supplements. You've got Part A, you got Part B, you got Part D, and other benefits. So includes your Parts A and B, just like the supplement, but now you're also getting D. So you got the A, B, and D all combined. So you don't have to worry about paying for an extra prescription drug plan. It's all included. And then you may have other benefits like vision, hearing, and more included. When Joan researched Medicare Advantage plans, learn how to qualify. You get enrolled in Part A. You have to live in a plan area. So that's why when you talk to your agents, they're going to ask you what your zip code is and your county, because that's what determines, even if you live across the street, but it's a different county and zip code, they can have totally different plans. Medicare Advantage plans. So think of your supplement plans are all PPO. Go anywhere you want, any doctors you want. As long as they take Medicare, you're good. Medicare Advantage plan, there's HMO plans and PPO. I know many years ago there was a bad press about Medicare Advantage plans. They don't cover this, they don't cover that. The PPO plans do, which we can talk about later. HMOs, you guys stay within the guidelines. But both plans must maintain Part B coverage, $0 low monthly premiums. So they have either $0 or they have very low premiums. There is co-pays. There are co-insurance, so when you see your doctors, and there is an out-of-pocket. A lot of plans don't have deductibles, but they all have out-of-pockets. And the out-of-pocket, $2,500 up to $5,000, $6,000. It all depends. So that's why I always tell people, compare your supplement plan premiums, $150 times 12, versus your total out-of-pocket with Medicare Advantage plan, because that's what the biggest thing is, you're looking at your out-of-pocket. Try to save you some money, but still getting great coverage. HMO, non-emergency care from network providers, care coordinators through primary care physician. So that would be like you're going to go see your primary doctor and you hurt your leg. So you always go to your, I call him the captain of your ship, and then he's going to steer you toward other doctors as you go. He's the gatekeeper. That's what the HMO is. You got the primary doctor, they move you to the orthopedic doctor that it's in their network. But your next door neighbor is an orthopedic surgeon, is not in a network. Then you say go to PPO plans instead. HMO, you're just always staying in the network. And if you're older, you've always seen the same people, they're all included, then your HMOs are totally fine. A lot of people love their HMO plans. My parents are on one. They used to be on PPO, now they're on HMO. And then referrals for services may be required. So as I said, we need referrals from your primary to get to your specialist. PPO, in-network, and out-of-network providers. So what's that mean? So I can go see the one that's in-network, $0 for my primary doctor. Usually primary doctors, I want to make sure they're always in-network. Let's talk about specialists. My specialist, I want to go see, if it's in-network, it's been $30. Now it might be $60 for out-of-network. There's always different pricing. And that's also for the out-of-pocket. The out-of-pockets can be higher for out-of-network than in-network. No, but you don't have to have a primary care physician. I'll always recommend you should. And then freedom of choice refers generally not required. So you can go anywhere you want. You don't have to listen to them. Also, when you go out of countries, a lot of times you're allowed to use your PPO plans for that too. Also, supplement plans do work out of the country also. Medicare supplements pay Part B premiums, have a higher premium. This is all for Medicare supplement plans, little or no out-of-pocket costs. So if we talk about that G plan, and then we got that $260 deductible taken out, we have nothing the rest of the year. Versus the Medicare Advantage plan, you pay your Part B, you'll always do that. You might have a $0 premium, you might have a 30, 50, 100, 200, whatever that might be, but there's different plans based on your needs. And then you'll pay this co-insurance as the plan talks about, and you got the out-of-pocket. Provider choices, any provider accepting Medicare. So you can, anybody takes Medicare, like I mentioned before, versus Medicare Advantage, you got a network. You can go out of network with the PPO, but they're all networks. Costs are higher out of network. Possible fits, if you're a frequent traveler, meaning going just to different states and stuff like that. Keep in mind, Medicare Advantage plans, let's say you have an HMO plan, but you're visiting your cousin in Florida, and you had to go to the hospital. No matter whatever happens, every single time, if you have an HMO plan, but you are sick going into the hospital, they have to take you. They have to take you for an HMO plan. So don't ever feel that you can't leave your house with an HMO plan. You can always go to the hospital. You can't go visit your cousin's doctor to get a COVID test, but if it's a hospital need, accidents, whatever it might be, an urgent care, you gotta go. You're still covered with HMO, and of course the PPO you are. Important to use any doctor, use any health services. And I always tell if you can afford the premiums too, and just don't like taking your wallet out, great. Infrequent travelers, comfortable with narrower provider choice, fewer provider visits, and want to save on premiums. Remember, you're paying a premium every single month when it comes time for, sorry about that. You're saving money because you're not paying supplement plans. You're saving money every single month with no premiums. And drug coverage. So there's no drug coverage in a supplement plan. You have to get that PDP or Part D plan. With Medicare Advantage plan, yes, in an MAPD plan, it is included. Some plans without drug coverage called an MA plan. I don't want to try to confuse you anymore, but there's the MAPD, that includes drugs, the MA does not. A lot of people that do the MA plan, most people I help, are those that maybe didn't ever sign up for a PDP plan and don't want to still pay that penalty. So I'll sign them up for that Medicare Advantage plan only. Or like the vets, the VA gives great discounts on prescription drugs. So that's why they like the MA only plan, because they get a little bit more benefits. Original Medicare Parts A and B, Medicare supplement coverage wanted, add Medicare Part B. So these are all things that you have to think about. Those are the choices versus enrolling in the Part C. The Medicare Advantage plan, which includes the drugs and does include prescription drugs. If Joan joins a Medicare Advantage plan, she doesn't need and can't purchase a Medicare supplement plan policy. So once you turn 65, keep in mind, when you first turn 65, you can have a supplement plan no matter what. There's no underwriting. You have 6 months to get it. So that's why for people, if you got cancers, if you got diabetes, if you got certain medical conditions, you're on hospice, you can still get a supplement plan that can't turn you down. After 6 months, then you got underwriting. There are certain plans you can get it, but it's going to cost a lot more otherwise. But Medicare Advantage plans, they have to take you no matter what. One thing I do want to mention that sometimes people always think about me is bring it back here a minute. This is one question sometimes people ask me. When it comes to all these other nice stuff, Medicare Advantage plans might include acupuncture, chiropractic, dental. So you get all this is the items you'll see in a Medicare Advantage plan. All these different items, except for this emergency outside the United States has partial. But everything else you're seeing here can be part of a Medicare Advantage plan. So this is why people love Medicare Advantage plans, because they're not paying for it. It's $0 premium in a lot of these plans. And yet I can get a certain dollar amount for dental. I can get a new pair of glasses. I can get some hearing aids. Some people think, I'm like, why shouldn't everybody be doing this? There's got to be a gimmick. There's got to be something about this. Well, what happens is we talked about in the very beginning that, and you see these TV commercials, I've got $100 back on my Social Security. That's also going to happen here. So what they're doing is the government, as we said before, for original Medicare, it's 80-20. You pay 20, government pays 80%. Or Medicare plans or supplement plans, 80 government, 20 the carrier, United Healthcare, Humana, and whoever. So now you got that 20%. They're still being, the government has to do something. They're still doing work. They're still employing people. When it comes to Medicare Advantage plans, the government's like, I'm done. I don't need to even worry about these people anymore because the carriers are taking care of them. So since the carriers are taking care of them, I can save on payroll, whatever their need is, but they're saving 1,000 to up to 2,000, the number, whatever that number might be, per person per month. So they might be giving $12,000 up to $15,000, $20,000 a year just for one person that they don't have to take care of. What do the carriers do with that money? They can get you this fun stuff here. Now I can get the dental. I can get those fillings taken care of. Now I can get a new pair of glasses. Or you sometimes see someone get $100 back in their Social Security, that Part B that's paying $170, now they're paying $70. They're getting $100 back a month. When you see that, you know if they're getting more money for the Social Security, then they're not going to get as much dental. So there's only a certain amount of money they can use. But this is the way they entice everybody by these nice little extras here. And the government is helping subsidize it by paying this. So people always think there's something, a gimmick about Medicare Advantage plans. This is how it really works. It's the backside. A lot of people don't see this. So don't be as scared about Medicare Advantage plans. I do both. But a lot of people always had a bad taste about Medicare Advantage plans because they couldn't figure out how they worked. And that's how it works. All right, we're almost there. So at educational events, there are other ways to find out Medicaid. So you can still be on Medicaid and Medicare. A lot of people don't know that. And you can take advantage of that. There's some nice plans out there that you can have Medicaid, Medicare, and if you have diabetes and heart stuff. I mean, there's lots of different things out there. So why not take advantage of that? You don't just have to have Medicaid once you turn 65. You can have both as long as you qualify. So Medicaid helps pay the cost that Medicare doesn't. They provide some benefits not covered by original Medicare. There's savings programs, health pay parts A and B, premiums, other cost sharing, deductibles, co-pays. One of the ones that I've noticed a lot of people I've talked to in the area, they've heard of low income subsidy or extra help, but they don't even know what it is. If you make an income under a certain dollar amount, you qualify, meaning your prescription drugs that are so expensive can be half, third, or even don't pay anything at all based on your level. Usually if you're on Medicaid, you should be on LAS already or extra help. But sometimes people are on extra help and not on Medicaid. And you should definitely find out if you qualify. I mean, if you're making 30,000 or more, 25,000, don't bother trying this year at least. But if you're making under like 20, whatever, you should definitely, there's a website, or I can direct you to the website that shows you. If you look up extra help, if you want to write it down, look it up, low income subsidy, see if you qualify, you should always sign up for it because that'll help pay your prescription drug costs. It'll be very helpful. So it helps pay Part D prescription drug costs, premium deductible insurance, helps with gap. But next year, like I said, we're down to $2,000. And then there's some based on certain states, like Pennsylvania has different pharmacies, and a lot of different states do different things. So it's all state bound, and I'm not sure where everybody's calling in from. When can Joan get started? She can initially enroll 3 months before, during the month of your birthday, or 3 months after turning 65. I tell people to call me up 5 months before, 4 months. I help guide them because you have to go to the Social Security office, or you can go online and get it. But we want to make sure you get parts A and B. I've seen it as early as 2 weeks. I've seen it as 2 months. It can take a while. So you want to get going because it always starts the first of the month, unless your birthday is the first of the month, then it's the month before. But it always starts. If your birthday is August 15th, boom, August 1st, you would start. We go back 3 months. We start looking at the whole process. You can sign up even 3 months before your plan. Each year, there's an annual enrollment period. So that's why I'm here now, 10/15 to 12/7. That's known as annual enrollment period. So this is the time when you can move. So like I said before, if not me, please go to somebody, talk to them, because there's big changes going on this year. You want to make sure that your plan still meets your needs. If it doesn't, switch it. And there's no harm in it. You can switch every year. I got people that might always try something new. If you're always happy to carry, that's great. Maybe they have something else inside there. But you should always, hopefully your agent's talking to you every year. But you should definitely take a look. Usually on 10/1 is when it all starts. So make sure you talk to someone that first 2 weeks because you'll get more time with them to figure out where you are. And then outside AP must have qualifying events to make changes. So some of the events are you moved outside the plan area. So once you move your zip code and county, double check. You might be able to qualify for a different plan. You have to actually get a different plan if you move your zip code and county, or if you move out of state. You move back to the US from another country. You moved into or out of long-term care facility. You have traditional Medicare, but want a supplement plan. So you can always go, if you have traditional Medicare, go to supplement. But remember, you can only, when you turn 65, not have underwriting. And keep in mind, if you have a supplement plan for 15 years and you've been hearing, you know what, this Medicare Advantage plan doesn't sound so bad. Wonder if I could try it, but I don't want to lose my supplement plan because it's been covering me so well. You are allowed to move from a Medicare supplement plan to Medicare Advantage plan for 1 year. I call it a look-see period, whatever you want to call it. But you get 1 year to try it out. If you don't like it, boom, go right back to the same plan you had before. They have to take you no matter what happened during that year. And you still get the same premium, so they're not going to give you any deductibles or any kind of penalties by leaving them. You're allowed one time in your life only to switch from supplement plan to Medicare Advantage and go back if you want. Or you can just stay with it, but at least you have that chance to do it once. You're released from jail, or you lost coverage from your employer, meaning that I just talked to someone today. He turned 65 this December, but he's still working. He's probably going to quit in March. So we're going to look at his plan. We're going to see what the out-of-pockets and deductibles are. If the Medicare makes sense financially for him, we might start him December 1st. Otherwise, I'm going to say, you know what, stay through April or March, whatever, you're going to leave your company, then sign up for Medicare. So once you leave your company, even if you're 67 or 72, if you're on a group plan and you like it, stay on it, then you do Medicare right afterwards. Additional resources, definitely Medicare.gov or SSA.gov benefits Medicare. This is when you want to sign up for your Medicare plan. And That is it. I did a very quick, like I said, this is educational only. I'm not allowed to go into details about plans and stuff like that. I don't know if there's any questions. Like I said, this is my name, my phone number, my email address is on the other slide. Feel free to contact me with any questions. Just, you have to say, Michael, please contact me, because like I said, I'm not going to call you. I'm not allowed. I follow the rules.
Michael, we've directed a couple individuals to reach out to you after, because their questions I don't want to share because it could share some HIPAA information, and I don't want to do that. But
Perfect.
could you explain what is a Medicare savings program, and for a first-time Medicare recipient, do they have to apply for Medicare and the savings program simultaneously?
A first timer, when you're signing for Medicare, you want to sign up for everything at the same time. Medicare savings plan, you don't see a lot of those anymore. A lot of times they're just from your previous jobs. You can use that money from your HSA accounts, health savings accounts, to help pay for those medical expenses still. But when you come into Medicare itself, very, very few people do the health savings accounts anymore. Very, very small percentage.
Okay, a second question. Is there a price breakdown for each part, including if you do them together? For example, price for just Part A, just Part B, Part A and Part B together, or all four, etc. How does that pricing work?
Well, let's make the assumption you've already worked that 40 work periods for 10 years. You don't have to worry about A. If you didn't, let's say you just moved this country 3 years ago and you want to get Medicare, then you'd have to pay that Part A. Part B, everybody pays no matter what. As long as you want Medicare Advantage or Medicare Supplement, you have to have B. That's $170. So the only time you're really paying is $170. Let's use Medicare Advantage plan. Everybody's paying that $170, and then they're going to pay whatever the premium is. Medicare Advantage, $0 up to, there's one plan that's $202, I think it is. Most of them are 80% or zero. So you only be paying that $170. Case two, still paying that $170 for, now you have a supplement plan. The supplement plan might be $150, $130, $120, whatever the dollar amount is. You're paying those two plus Part D for prescriptions, which is this year there's as low as $0, but they go up to $110. So you could pay 3 different things if you have a supplement plan. If you have original Medicare and you don't want a supplement plan, you don't want an Advantage plan, you don't pay your A, assuming you worked that 10 years. B, you pay the $170 and you just pay the prescription drug plan only. And that's it. So original Medicare, you're just paying 2 things. For a supplement plan, you're paying 3. And for Medicare Advantage, you're paying 2. And keep in mind, all of them have in common is that $170 Part B.
Okay, so the next one I'm going to go to is, I won't receive Social Security until I am 67 years old. How do I pay my Medicare premium?
Check. What they do is they'll pull it out of your, I don't think you can do credit card anymore. Even if they offer credit cards, I always tell people when I work with them, we always pull from the checking account every single month. A lot of people don't even take until they're 71 years old. So the reason why I tell them to use checking versus credit cards get stolen, lost. If you forget to pay it once, you can get a penalty. Don't forget about those penalties for that Part B. Also, there could be a penalty, but for if you don't pay that $170, but also Part D, you can get a penalty. So I always tell people, make sure you pull it out of your checking account. What they usually do for those people that are pulling from their checking account and not from the Social Security, they'll take 3 months at a time. That's what I'm doing with my sister in Ohio. So if you do from your Social Security check, then it's every month that'll pull out that $170. Otherwise, it's going to be like $510 or whatever it's going to be next year. Every 3 months, they'll pull money out of your checking account.
Okay. With an Advantage plan, who covers palliative care?
That's a really good question. Hospice is covered under Part A, which is still covered with the Medicare Advantage plans as well. I would assume that palliative, I haven't had anybody come to me with palliative. That's a great question. whoever that person is, if they want to contact me or whatever, I want to research it. I'm guessing it's like a hospice. I know it's not exactly like hospice, but I would assume it's in the same category. So I don't want to misspeak. But I will definitely check for you if you contact me, and I can get you an answer.
Okay. So I think this is a two-part or two questions in one. I don't take medications now. Do I still have to buy a Part D plan? And then the second part is, what about signing up for Part G plan?
Okay. I don't know what your situation is, because are you on Medicare, original Medicare A and B only? You don't have to do anything you don't want to do, first of all. This is you. This is your body. You can do what you want to do. Highly, highly, highly recommend that you get the D plan. If you're on that supplement G plan you're talking about, you're going to have to get a prescription drug plan. If you have original Medicare, you're going to have a prescription drug plan. Have to, in my case, means if you want to avoid getting penalties, because you're nice and healthy now, but trust me, I've worked with enough people when they get in their 70s, 80s that finally start kicking in with medications, getting very expensive, and they're getting $40, $50, $60 penalties every single month because they didn't sign up in the beginning. Why not pay at least a little bit less now? I mean, like I said, there's plans that are very inexpensive. I don't know what's going to happen next year because that whole donut hole is no more 8,000. We're down to 2, so everything's going to go up. But I still would highly recommend you want to make sure you get that Part D. And as far as Part G, that's the one I like the most as far as supplement plans. There's that or the N. The reason I like the G before is because you pay that deductible once for Part B, and then you're totally done the rest of the year, versus if you got that N, you're paying the doctor bills possibly, and still paying the deductible.
All right, Michael. Thank you for a very educational presentation with some really succinct answers to some of these questions. Everyone, we thank you for joining us today, and we will have this up on Elderwerks YouTube and Facebook page shortly. Have a great day, everyone.
Thank you.